My name is Michael Summa. I'm a clinical leader for CRNAs at the Bone and Joint Institute at Hartford Hospital. I'm also a clinical lead for the SRNAs through our SRNA school at Hartford Hospital. I represent the bone and joint in the teaching aspects at that facility.
Can you describe what you like about IAA?
So when I came here 15 years ago, it was HAA, Hartford Anesthesia Associates, and then it grew into a relationship with another group in Connecticut and became IAA. But even back then, they were a great group to deal with and to work for. They gave you every opportunity when you came here to grow and to find your niche and to find what you liked, and anything that you wanted to do. You could work 8-hour shifts, 12-hour shifts, 16-hour shifts, weekends, day, nights. You could do cases such as transplants, cranies, anything big, small. You could credential at Children's, credential in OB, and that type of opportunity is pretty rare in the state.
So they give you a lot of freedom for the types of cases that you...
Has IAA allowed for flexibility?
Yeah, they really did. You would get your general assignment, and you would basically become very good at what you did. And as the day went and rooms closed down, you were able to transition to other rooms and get good at those types of cases, that field of surgery, that type of thing. And that's how I grew. I worked a lot of hours out of school, and I had the opportunity to get very good in a short period of time. I worked Saturdays, did a lot of trauma. So it was a great opportunity. I never found that to be offered anywhere else in the area.
Do you have opportunities to pursue the fields you like to?
Yeah, I got to do the big cases shortly thereafter. To me, big cases were I did a lot of kidney transplants. I did a lot of craniotomies. I did a lot of big back surgeries. I did a lot of ortho trauma, and that's how I ended up at the Bone and Joint Institute 15 years later. To those who don't know, the Bone and Joint Institute is now a separate building that's been active for 4 years, and it does everything orthopedic-wise. It's all bone-oriented, and it's trauma included, and it's been growing every year.
Does IAA allow for work-life balance?
Absolutely, they do. That's the plus about having any flexibility with shifts. They allowed you to accommodate family. They were very pro-family, and they continue to be. They are very big on life balance. People work 12-hour shifts so they could have the next day off. Some people work 5/8 because they're home for dinner with their family. Some come in late because they put their children on buses. It's very, very flexible, and it's whatever you want it to be. I guarantee you there's a fit, and it does work out to the point where you become very good at what you do, but you also have everything else that you've ever wanted: family, hobbies, that type of thing.
Has IAA allowed you to grow in your role?
Some people grow faster than others. Some people take to certain aspects of variant surgeries quicker, line insertions, double tube intubations, very different levels of complexity. I found that it's kind of funny. It's one of those things you just don't really recognize until like a year or two later, or you look back, and then you realize that you have, over the time, become good at what you do. And then you become very good at what you do, and then you become excellent at what you do. And that's just the course of time. And the opportunity that they give you is the experience. They give you all the room you need, all the resources you need. I work with great attendings. I work with fellow trained anesthesiologists who have their fellowship in critical care, in pain. I have a really excellent group of people that I work with who are well diverse in more than just anesthesia, which really, really helps you a lot in a lot of given situations.
Can you describe the camaraderie amongst your team members?
Sometimes you don't feel like it does because it's you and only you at the head of the bed, but it's not only the camaraderie you have within the group of anesthesia, but it's the people within the operating room. The circulators, the scrub techs, the surgeons themselves, the PAs, the residents, you get to know them all. And it's really kind of neat because it's people you never realized before were really part of your world. Even the pre-op nurses and the post-op nurses, the ICU nurses, when you took critical care type patients up and you know got that relationship back, because that's where we all came from. It's a pretty big family, and it slowly matures on its own, and then you realize that it's very diverse. And it's just not your attending, or it's just not an anesthesia person. It's everybody else that makes up the team and allows you to be, you know, a part of the team, but even more comfortable with yourself and what it is that you do.
Does IAA feel like a small or large institution?
It's kind of a little bit of both. I mean, it was HAA and then it became IAA. So in that respect, they've grown. They become bigger across the state of Connecticut. But it's also a very diverse group. Like, there will be days where I do work with the same people day after day after day because I'm in a certain concentration, or I'll work 5 days and work with 5 different people. It really depends on what you do. And again, it's all the learning aspects that you take out of it. As you work with the same person, they get more comfortable with you, you get more independent, you learn more. Or you basically learn with 5 different people over 5 days, and what you learn is 5 different viewpoints, 5 different ways of doing something. So it's constantly changing and it's constantly learning. Not that everything's great, but sometimes, you know, you learn what not to do as opposed to learn what to do. And that is really a great thing here, because we're so big. The hospital offers so much that you just get it in so many different.
Does IAA provide educational opportunities?
Yeah, they do. We have continuing education through our Thursday morning meetings. We have Thursday morning meetings every week, and it allows us to kind of catch up on changes within technology, medications, practices within the hospital. They have a very generous education fund so that we can go to you know, outside conferences and skills sets at different facilities. So they're very much in education in that respect for us.
What do you find most rewarding about your career at IAA?
I like the fact that I kind of built my career. I came in as a newbie, new grad. They treated me very well right out of the gate. And now I'm very comfortable. I'm in 2 clinical lead roles. I have a lot to do with the success of the Bone and Joint Institute, with the students being trained properly in the OR, writing policy and investigating issues at the bone and joint, which is another way of saying streamlining or making things better, as well as being a CRNA, taking great care of the patient, having that camaraderie with those specific surgeons at the Bone and Joint Institute, who I've known for a long time, 10 years. I've watched surgeons who are there now when they came in as a first-year resident. It's kind of neat. So it's very gratifying.